There you go. All right, guys, welcome. So today, interpreting techniques, skills, core, what's going on, how to do everything, how important it is, and why does it matter? So today we're gonna discover and unpack all the secrets and how everything is supposed to be done. So we're gonna talk about the importance of the whole training and why we're doing it. We're gonna talk about the modes, risks, managing and the interactions, and your professional presence. I also added a little bit about the real life challenges. Also a little bit about the questions that were asked in the last two sessions about the conflict of interests and stuff. So yeah, we'll see how it goes. All right. Importance of professional interpreting, and what's going on and why does it matter? So accuracy again, this will work. Believe me, I'm gonna wake you up probably at 1 a.m. in the 1 week and you guys gonna just keep saying accuracy. So how we can improve that, how we can improve safety during the sessions, benefits to the clients, patients, the healthcare providers of your interpretation of your service, understanding of that profession, and then we'll go like the cultural trust, how to act during those sessions, all the improved health outcomes for the patients, and the efficiency, costs, time. So starting from the first one, accuracy, like we talked about this so many times. But yeah, everything as well. Everything must be said as we remember, as it is, and need to be conveyed in a good faith, right? So nothing can be missed, nothing can be changed in neutrality. So pretty much this topic, I have a video for this topic that actually explains it a little bit more and can show you like the basics of that. So let's just hop into that and then we're gonna jump into the benefits. Let me see if I can share the screen here. All right, good. Stop and share. So the real life scenarios probably are better than just explaining and putting the letters. If you guys can see what's going on, that can help a little bit. All right. So we're starting from the interpretation itself. So like the body posture and then we'll go through everything else. Okay.
This video you will see common mistakes of an untrained interpreter, followed by the proper technique of a professional interpreter.
Hello. Let him know that I'm glad he's here today. I just want to start out asking him some basic questions, so let him know that I'm. Ask him who lives at his house.
Pues vivo yo, mi esposa y 4 niños.
Said that it's himself, his wife, and his 4 children.
Okay, what are their ages?
Uno tiene 13 años, 10, 5 y 2.
Said that his children are 15 and 2.
Thank you for being here today. I really appreciate you coming out. I just want to start by asking you just a basic question.
Quiero hacer una pregunta básica.
Who all lives at your house?
¿Quiénes son los que
Vivo yo, mi esposa y mis 4 niños.
myself, my wife, or children?
Okay, what are their ages, children?
Y sus hijos, ¿cuántos tienes?
Uno tiene 13 años, 10, 5 y 2 años.
One is 13,
Okay.
Whenever possible, an interpreter should sit to the side and slightly behind the target language speaker. As you saw in the video, this emphasizes the message, not the interpreter. It reduces distraction and allows the parties to engage each other, not the interpreter.
So as you guys noticed,
Mr. Sanchez,
it's pretty important where do you sit and how you do provide interpretation. So just keep in mind that you are always close to the patient. Also, in the legal settings, you'll be close to the client most of the time as well.
you know why you're here today?
El señor Sánchez, él quiere saber si está aquí hoy.
Yo no tengo la menor idea.
He's good.
Well, I received a report with some concerns about your son Luis.
¿Qué tipo de preocupaciones?
He wants to know what kind of.
Okay. Well, the report says that Luis has an injury to his eye, and I'm concerned about
Que Luis está preocupado por su ojo.
No, él dice que él está preocupado por lo que escuchó Luis.
¿Y qué tipo de preocupación tiene?
He wants to know what kind of.
No, I think is there any possible you can do some change?
Mr. Sanchez, do you know why you're here today?
Señor Sánchez, ¿sabe por qué estamos aquí hoy?
No tengo la menor idea.
No, I have no idea why.
Okay. Well, I received a report that has some concerns about your son, Luis.
Recibí un reporte.
¿Qué tipo de preocupaciones?
What type of concern?
Well, there's concerns about something that happened to his eye.
Unas preocupaciones será porque.
¿Qué pasó? ¿Cuál es su preocupación?
Well, what happened? What's your concern?
A trained interpreter should always interpret in first person. This is the standard of professional interpreting. It allows the interpreter to become transparent, allows for a more accurate message to be conveyed, and reduces third-person confusion.
Okay. How did Luis end up with a black eye?
¿Y cómo llegó a tener un ojo negro moretón en el
Pues él se golpeó con... no, él estuvo en una pelea.
He was in a fight.
He was in a fight. Okay, can you tell me about this fight?
¿Me puedes contar un poco de este pleito?
Pues él estaba en el camión de la escuela, camino a casa, y hubo 2 muchachos que empezaron a molestarlo y le trataron de quitarle su dinero, o le quitaron su dinero y le pegaron y le marcaron un ojo.
There were some boys on the bus that hit
Okay. What else?
him. ¿Qué más pasó?
Pues cuando él llegó a la casa y me dijo, yo le dije a él que él tenía que aprender a defenderse, que él era muy blandito, tenía que ser más valiente y pelear.
I told him that.
Okay. So, what happened to Luis's eye?
Entonces, ¿qué pasó con el ojo de Luis?
Pues él se golpeó con... no, él venía del camión de la escuela y había unos muchachos que lo estaban molestando y lo golpearon en el ojo y le quitaron el dinero.
We were to, no, actually, he was on the school bus and they hit him in the arm. Took his money.
So this happened on the school bus?
Entonces, esto pasó en el bus escolar.
Sí, fue en el camión de la escuela.
Well,
Escolar.
okay, so if it happened on the school bus, we can get the video camera from the school bus, see what happened.
Sí. En el bus escolar podemos ver el video del bus escolar para ver si realmente pasó.
Ah, bueno, tal vez no sea necesario porque pensándolo mejor, yo creo que eso pasó más tarde.
No, maybe it's not thinking about it, it might happen later on.
Interpreters should never add, omit, or substitute any part of the message, even if it seems redundant, irrelevant, or rude. When an interpreter adds or omits, it generally takes away from the message, eliminates useful information, and can change the intent of the message.
Okay, just wait 1 second, I need to look through some papers real quick.
Espera un momento, tengo que revisar.
¿Y dónde aprendiste a hablar?
En Honduras.
¿Honduras?
Sí.
Mi esposa es de Honduras,
¿Sí? ¿De cuál parte?
de La Ceiba.
De veras. Yo soy de la Ceiba también. Bueno, desde niña vivía allá.
Oh, qué bien.
Sí.
What were you guys saying?
Children's place.
Oh, okay. I have a few more questions for you, Mr. Sanchez. Hold on 1 second, I need to look through my notes.
Espera un momento, tengo que revisar mis notas.
¿Y dónde aprendió usted español?
En Honduras.
En Honduras, mi esposa es de Honduras,
Entonces,
de La Ceiba.
he's actually asking me.
Okay. Well, Mr. Sanchez, I have a few more questions for you.
Side conversations should be rare and should never exclude the other party. Ensuring that everything is interpreted reduces suspicion and confusion. Further, interpreting everything ensures that professional role boundaries are maintained.
So, questions? Anyone? Do we have questions regarding this video?
Sorry, I just wanted to say that it was kind of cutting off, so it was a little hard to understand exactly the whole sentence or how they were talking. So that's, yeah, I just understood a little bit.
Well, so, I mean, but at the, like, yeah, sorry for that. My computer is not the best one. But regarding like the ideas and the rules, is there anything that you guys think that you not agree with? Or you will handle differently? No? Nothing? Okay, good. That's okay. All right, so let's hop in next to
Me. I have a question,
Sure.
a quick question. In terms of the position where we supposed to be sitting with the client, I didn't quite understand. Do we need to have a position and a specific position where to sit if there is an appointment? Because
Pretty much, yes.
I couldn't be able to get that.
Yes, so the idea of that is that you don't want to sit between them. You want to sit, like, you don't have to sit right beside the patient, but you can be in that area, kind of like circle, right? To be close to the patient. So you want to also avoid that eye contact between you and the doctor, because that's going to switch the conversation between you and the doctor. And again, if you also skip the first person, the conversation is between you and the doctor. So at that moment, the patient is pretty much ignored totally. He's just there, like just as attachment, I would say, right? So to avoid that, and also the interpreter and the patient is not getting that stressed as well, because now they talking directly to the doctor. Like they don't have to look at you. They don't have to. Sometimes they, they're looking with your acceptance as well. Like if they are saying this stuff, is it correct or not? So they're gonna look for that eye contact, and it can be distracting as well a little bit. So you're trying your best to avoid that and sit beside them, close to them, behind. Just not like try to avoid anything in front of them, pretty much.
Peter?
Yeah.
So yeah, like after every little session, they did correct things. So I guess it was okay. Like after a session, they corrected what was wrong, and then so there's nothing. I don't think there's anything else that we really need to correct. But I'm glad that she brought up the positioning, that it should be more like a triangle kind of thing. You're not more to, like what you just said. You're not more to one party side, closer to one party than the other. Yeah.
Yep. All right, so let's hop to the next one. Those benefits and like how does it work? There you go. So all interpreters, like if the accuracy and like the improve accuracy and safety during the sessions, where the interpreters are present, will reduce a lot of different errors, especially if the patient try to bring their close ones, friends, or like maybe someone from the hospital will try to translate. Those situations were happening as well. That if the doctor knows, like, okay, there's a lady working on the reception and she speaks that language, maybe we can take her to help with the translation. So a lot of those situations can lead to problems because not everyone is that accurate and good. So it can be misdiagnosed. It can be like the treatment can be not proper. Change of something of the information can be there, right? So it's very important to have the professional interpreter with the best accuracy there. Now to like the understanding is pretty much the you as an interpreter need to understand this medical terminology as well, the medical jargon that the doctors are using. So the more appointments you will attend, eventually the more you're going to understand. I'm guessing in each of our countries also the healthcare and the doctors might talk differently. There might be a different approach. They might speak to you differently as well. So like when we are here, it's best to understand like how doctors do proceed and what kind of terminology usually they're using. So understanding this whole situation will pretty much help you and help the patient, right? So that's something that probably is an ongoing training, because yeah, the more sessions you will do, the more you will learn, and then eventually you can be the master of that. Now the cultural competency and the trust, well, that's something where we're talking about different beliefs, different practices, different environments. There's also can be difference in the gender preferences, right, in the different cultures. So that also will build that common trust during the sessions when there is a person that they can they can connect with. But again, that's where you also need to set up those boundaries, even if you're from the same country or same area. And there's a lot that you guys can share together. You still need to stay professional, but understanding the culture idea build trust a lot. It builds up that trust. Same like in that video where for you setting up the boundaries when the patient when the client try to talk to the interpreter, like where is he from, and when the interpreter, you know, on the second try, like she just cut the conversation right away. So even if they're like from the same places and stuff, or their families are from the same places, you still need to kind of like let know the doctor or the healthcare provider what's going on during that situation. So just keep that in mind, right? Health outcomes and like how to improve are those health outcomes. So pretty much when the professional interpreters providing interpretation, it's a high quality like interpretation, it will help the patient actually leave that room with a little, maybe, well, I don't want to say relief, but they understand more. They are actually happy about that there was a meeting with the doctor and they understand everything, and there were no language barriers, so that stress pretty much disappears because now someone actually explained them what's going on with their health, right? So that's probably the best outcome that we can have when the patient or the clients is actually leaving the session and they actually understand what happened, what was provided to them, what information were in that during that meeting, and now they know like what they can do next. The cost and times. So again, so there's a lot of situations when sometimes the patients or the clients, when they try to do it privately from their own pockets, and before they will actually get a good interpreter, they might to hire 4 or 5 different interpreters. They will pay for those appointments. Maybe they have to pay also for their visits. So again, they have to pay like 4 times for those visits. So there's a lot of time-consuming sessions that will not bring any outcome. Plus, they will waste a lot of money on that, or the insurance companies will get involved in that. So a good interpreter that can actually get everything done during like 1 session, maybe 2 sessions, will always gonna be better. So taking a look on that, it also help you as an interpreter that, hey, now we finally found a professional who can handle the meeting like right away, and can handle professionally, so we don't need to hire anyone else anymore, and we do not to waste money or spend money anymore, right? So pretty much at the end of the day, that's how it works, right? Now all the professional interpreters must be sure that whenever the session is ending, that you guys are sure that the whole service was provided well and the patient understand everything, and there is no other issues that they have to ask again, right? So there's no miscommunication between them and the healthcare provider or the lawyers. There is no any other like additional errors. So thanks to you as a professional, there is a like they actually can say, okay, that session was complete, was good, and now we can proceed, let's say, with the treatment right away, or the proper diagnosis are coming up, right? All right. What do I have next here? Let's see. Before we jump to those modes, and what I can mention here is that eventually, if you are a good interpreter, you building also your own name with the clients or the hospitals or the companies. So yeah, in the healthcare, it matters because they always know that, yeah, you're correct, everything's clear, there's like the situation and the meeting was safe, client was treated with the respect, eventually ended up the sessions, understand everything. So it will help you in the future as well, because now they know that they don't have to call other 5 people. They can just call you directly for that, right? All right, so we talked about this, I believe, yesterday, and on Tuesday, I think. So all the modes that interpreters do, starting from the consecutive interpretation, which is the like in the video. So the English speaking person speaks, you translate, patient speak, you translate, and it's going in a circle. So there's the speaker, pause, right? Then we have simultaneous interpretation, which is kind of like a whispering as well sometimes in some of the sessions. So in this case, simultaneous interpretation is like you're going in real time, and almost in the same time, I would say. There is a gap between the original speaker and you, but that gap is usually not longer than a few seconds. So it's very difficult. It's very difficult. I believe usually people with a lot of experience doing that, and after long trainings, because yeah, you have to keep up, and your brain is pretty much constantly working in both languages all the time, and it can be exhausting. Whenever we provide that kind of interpretation, and interpreters working in those cases, they usually work in pairs. So there's 2 or more interpreters, even if the session, let's say there is a session for 4 or 5 hours only. In those situations, we usually have 2 or 3 interpreters. So that's how exhausting it is. And they need to have a break. So if we're talking in medical settings, if there's like a long explanation about maybe a mental health issues, maybe there's a huge group session where the interpreter need to be there, and let's say they want to provide information in the clinic for families from the area. If there is like a family gathering up, and there's a discharge of the patient, whenever like everything needs to be said at the same time. So that's where the simultaneous interpretation can be used. Sometimes at the court as well, it happens, but usually simultaneous situations will happen in the environment more to like a political related. So probably all of you have seen the conferences, the big conferences where all the nations are maybe sitting, right? And then you have the separate rooms for the interpreters, and they are providing interpretation at the same time. So yeah, that's pretty much how that works. Now the active listening and the delivery. So again, here, this is something like an ongoing training for interpreters itself. For active listening, you will, like, your brain need to also speed up, because in a short period of time, a lot of information can be provided, especially about maybe terminology, medical terminology, maybe numbers, dates. A lot can be involved in that, and you need to be sure that that message is delivered. Sometimes from the client perspective, or the patient perspective, sometimes they will start telling the story, and you need to focus what information are actually important in that, and those information also you need to keep in mind to provide to the doctor, for example. So probably taking notes can help, and we will talk about taking notes a little bit today as well. because that was a question. Now, during the active listening, you still need to provide that interpretation from, let's say, your language to English, or vice versa. And in that case, like, you still need to keep the same meaning, the same tone need to keep. If there are emotion involved, sometimes, yes, those emotions can be also delivered. So interpreters eventually turning to I would say a real clone of the patient, because also now, if those emotions are involved, you have to deliver those emotions, the frustration, that fear, maybe that lack of belief from the patient's side. So, like, the doctors, they need to be sure that, okay, so the patient do not trust us with this diagnosis, for example, right? Plus, you also don't want to sound like just like a machine, pretty much, right? Okay, so again, we have a couple videos. I'm so happy today about the videos. I found so many. Hopefully, this one will be better and will not be interrupted. So we'll see.
Simultaneous interpreting is very different from consecutive and how it can be delivered. In simultaneous interpreting, the interpreters are interpreting just a few seconds behind the speaker. The speaker doesn't need to pause and wait for the interpreter to finish before continuing, and the message is delivered moments after being spoken. Simultaneous is best for communication when there will be only one primary speaker with limited dialogue. Consecutive interpreting
I didn't share
requires
the screen, right?
pause after a few sentences, allowing the interpreter to deliver the message before the speaker can continue. Naturally, this way of interpreting takes longer. It is best for encounters where there will be back and forth communication between participants. Consecutive interpreting can be delivered via OPI and VRI because only one language is being spoken at a time. However, remote simultaneous interpreting, RSI, needs special technical adjustments so that participants can hear their preferred language without the interference of the other languages being spoken.
All right, so that's just the briefly one. The other one is a little bit different. Here you can more.
Now, there are two styles of interpretation, simultaneous and consecutive. Consecutive is the most common style of interpreting in diplomatic situations. Here's an example.
It's been a while since I've been here. I'm so excited to be back. Thank you for having me.
And then?
Desde hace bastante tiempo que no venía, así que muchísimas gracias por recibirme nuevamente.
The interpreter waits until the speaker pauses.
Estamos muy agradecidos de poder colaborar nuevamente con el gobierno de su país.
And then interprets.
We're very happy to be able to collaborate again with the government of your country.
Simple, right? But what happens if the speaker goes on and on without pausing?
Estamos muy agradecidos de poder volver a colaborar con ustedes.
Interpreters rarely translate word for word. Instead, we remember specific ideas and translate those ideas accordingly. But when the speaker goes on and on for a long time, interpreters rely on note-taking.
We want to authorize the use of the dolphin-friendly label by your country's tuna processors.
These symbols represent the speaker's ideas.
The use of authorized equipment and
But each interpreter has their own style. Watch as 3 different interpreters take notes on the same sentence.
We want to authorize the use of the dolphin-friendly label by your country's tuna processors, but we must have a reliable way to verify the use of authorized equipment and fishing practices.
Interpreters usually come up with the symbols beforehand. And as you can see here on Caddy's cheat sheet, she carefully thought about what will be most useful for this particular meeting. The DFL stands for Dolphin Friendly Label. The TU in a box refers to tuna that's being caught. You get the idea. Now let's watch as Caddy interprets her own notes into Spanish.
Queremos autorizar el uso de la etiqueta de Dolphin Friendly para los procesadores de pescado de su país, pero necesitamos poder verificar que estén utilizando equipos y técnicas de pesca adecuadas.
Now let's switch to simultaneous interpretation. Simultaneous interpretation is usually used with earpieces and microphones and with interpreters working from a soundproof booth. But we won't have equipment in this demonstration. When we're right next to another person, like in this scenario, we can employ what we call chuchotage, which means whispering in French.
Considerar este tipo de medidas para que los
This usually isn't ideal. Whispering for a long time is bad for the vocal cords. It can also be hard to hear due to ambient noise in the room, like ventilation. Now let's talk about pacing. In simultaneous interpretation, you try to maintain an optimal distance from the original speaker. This is referred to as décalage or ear voice span. We'll call it EVS. So when one diplomat starts speaking, the person employing chuchotage would probably start here.
Study perfectly the preferences of the consumers in our country. And that's why we are coming together to identify.
Even if the speaker is speaking at 100 to 110 words per minute, which research tells us is the optimal speed for interpreting, the interpreter still has to figure out the optimal EVS. Here's the problem. The further back in the diplomat's speech the interpreter is,
los consumidores de su país, y por eso también queremos reunirnos con ustedes.
The preferences
the more the interpreter has to keep in their short-term memory. They're listening and processing as they're interpreting. It's a lot.
Is high quality dolphin.
But get too close to the original speaker's words, and they may screw up things like grammar, syntax, and style.
We understand that the preferences of the country of yours.
And of course, interpreters are prone to fatigue and burnout. Fatigue will hit at around 30 minutes of straight interpreting. This is why simultaneous interpreters often switch out in intervals of 30 minutes or less. If pushed to our limits, interpreters can really suffer. You may recall the 2009 incident in which Muammar Gaddafi's interpreter collapsed at the UN after simultaneously interpreting for over 75 minutes. So what happens if the conversation turns emotional or the speaker becomes rude?
Well, my friend, I've listened to what you have to say, and the only conclusion I can come up with is that you're a damn fool.
Interpreters are not meant to be mediators. Our only job is to stay true to the message of the speaker. If someone becomes rude or angry, if threats are made, then we are supposed to interpret those threats faithfully. So in this situation, an interpreter would not say,
Y la única conclusión a la cual puedo llegar es que usted ha sido un poquitito imprudente.
and here is an example of a faithful interpretation.
Y la única conclusión a la cual puedo llegar es que usted es un perfecto idiota.
Although a speaker may become emotional and gesticulate, the interpreter is not going to parrot the behavior of the speaker. This is not the way.
¿Cómo me puedes hacer esto a mí? Yo pensé que éramos amigos.
This is more realistic.
Pero ¿cómo me puedes hacer esto a mí? Yo pensé que éramos amigos.
How can you do this to me? I thought we were friends.
So the situation has gotten quite intense. Maybe a joke would be helpful to lighten the mood. But jokes are some of the most difficult things to interpret because they can get lost in translation easily.
What did one dolphin say to the other after splashing him? You did that on purpose.
Never mind that this joke barely makes sense in English. In Spanish, it completely doesn't work because porpoise is marsopa and purpose is propósito.
¿Qué le dijo un delfín al otro después de salpicarlo? Usted eso lo hizo encima de la marsopa.
Untranslatable pun.
No entiendo.
Attempts at humor are often lost, and there's not much an interpreter can do. There's an anecdote about an interpreter who, when faced with an untranslatable joke, simply said,
Oiga, su colega acaba de contar un chiste que resulta totalmente intraducible. ¿Si que ríese, por favor?
Estuvo bueno. Eso estuvo bueno. That was good.
Of course, what we have seen today is a tiny excerpt of what are often longer and arduous negotiations. And that concludes our bilateral meeting behind closed doors. This job is tough to juggle the many things that we have to do to be able to interpret well and accurately. But this job is important because it's what makes communication possible between countries and between peoples. I've been at it for 25 years, and I wouldn't trade it for the world.
Well, guys, what do you think? Abigail, I saw you laughing there. I know.
Yeah, I just wanted to mention that I think it's like he said, in terms of when we are making jokes, just not to be so rude, but at the same time, stay in the meaning of the conversation. I think it's something that it might sweet or smooth up the situation, but then not in all the cases will work. But at the same time, seems to me like the simultaneous interpretation when we are on that stage. I think it will help a lot more the practice. The more you practice, the more you can be able to continue and do what you're doing. Like it's excited. I would love to do that. I am not on that yet, but I think it's very important this information.
I think it would be very difficult, like, because now, like with consecutive, you've got a little bit of a break. You're just listening, and then you can kind of think about it in your mind, and then you interpret. Whereas with was it consecutive or simultaneous? That you're listening, you're interpreting, and you're speaking, but you're listening. Like you're doing all three things at the same time. And it could get difficult. I remember that when I interpret for physiotherapy clients, and sometimes they have videos to watch. So we're in a class, we're not separated, and you're trying to basically like whisper to the client, but then the professional will be like, "Oh, you have to be quiet because everybody's trying to hear." And I'm like, I'm an interpreter, and I don't know, like I have to interpret. So like, what do I do? Like not interpret? So it kind of like, and you're in a small room and you might have 3 or 4 interpreters. It gets a little bit noisy too. So trying to listen to other voices, like you hear other voices too. So it gets a bit difficult. Yeah.
Yeah, it is difficult. That's why not many people can actually do that. Well, thankfully for now we're doing consecutive most of the time. So yeah, not too bad. But I mean in both setups, still you need to keep in mind, like, how that accuracy works, and especially like in the medical settings. Sometimes, like Surinder mentioned here, if there is a video play, like I said, there might be a full class of families, and they're gonna study about something about maybe about their kids. So sometimes it can happen that we need to send an interpreter who's gonna provide that interpretation simultaneously and just tell the families like what's going on in the video as well. So yeah, all right. What are the risks if we have no professional interpreters in the room? Well, it can be pretty catastrophic for the patient most of the time. So the common family issues, all the time, ongoing problem, and that is happening everywhere, not only in medical settings. So if there's family member doing interpretation for the patient, we're talking about the patients this today, a lot of information can be filtered. Maybe they don't want to tell them something to not scare them up. Personal bias, again, there is a lot of information where the doctor can say about something about serious diagnosis, and eventually, because again, the family member will be biased and don't want to change the mood of the patient, maybe, or not to scare them. They will say like everything is fine, don't worry. There is nothing to be afraid of, right? Embarrassment, well, cultural sensitivity. So in this case, again, we never know what is the topic, and eventually we're sending our family member. So like some topics can be difficult to discuss among the families, especially if we're talking about the generations. I'm not sure if I would like to do any translation, maybe for my grandmother. or opposite, you know, so in certain, like in, depends from the cultures, I guess, as well, but yeah. Mental health. Well, if I will get my brother to translate for me, the last thing I want them to know that I'm crazy or there is something wrong with me. That can be embarrassing. If I'm going through something like that, it can be embarrassing, and I don't want them to know about this. So if they will do that interpretation, eventually it's gonna come out. The doctor is just gonna talk, and it will gonna come out. So mental health issues, any like personal problems, sexual health involved in that as well. So anything that can, you know, have an impact later on the family, that is a critical problem for that. Children, yeah, we don't want that. That's I was actually providing a webinar to students, medical interpretation students, last month, and that was one of the topics where how they should handle those situations as well. So using children is a big no-no always. The child cannot do that interpretation as the professional will do or adult will do, right? So they do not have those language skills yet. They do not understand terminologies. The vocabulary might be a little bit poor still. It depends from the age. No accuracy, definitely. If there is any complex, any technical issues, like the kids will not understand those problems. And in medical settings, it's very crucial. So if patients are usually taking kids as interpreters, yeah, it's very bad. It's very bad. And we always encourage, especially Alberta Health Service, to not give those ideas to the healthcare providers. Now, if we imagine a child that being asked to interpret like a diagnosis about the mother's cancer, like that's gonna impact both of them, right? That's something that can have some big changes for them. Again, if there's maybe a child and the father is there and there's a surgery going on, like how that kid gonna explain what's gonna happen after the surgery, like what are the procedures during the surgeries. So there's a lot of those situations where we don't want to have family members, right? So family members, it can be convenient for them because of course they're not gonna pay for it. It's easier, but the risk is absolutely colossal here. So a lot of things can happen, and yeah, something that we don't want to have. So again, we have a video. I love today's day. The good part is that I'm finding pretty accurate videos actually lately, so that's good. Well, we're not gonna go for the full 10 minutes. All right, so we have a clinical scenario. And that clinical scenario will go for a few minutes, kind of. But yeah. All right, so let's take a look on it. And that's where we can understand what is going on with the family members are involved in the meeting.
እንግዲህ ዶክተሩ ይመጣሉ የሚለውን እንሰማለን። እኔ ግን ምናልባት መጠጡ አብልተህ ሊሆን ይችላል።
Hey, how's it going? Sure to check see how you're going today, and then let's get some paperwork filled out and get you out of here, okay?
He doesn't speak English. I'll interpret for him.
Oh, you sure? I mean, I guess I could call our interpreter, but since you're here and you know him, maybe we should just go with that.
Yeah, I interpret for him all the time, so it's fine.
Sounds great. Good morning. How are you? I'm just gonna ask your brother some questions about how you're doing.
By the way, that's the most common issue that doctors do and healthcare providers, and not only them. I'm not sure why they consider people who do not speak English solely deaf, but yeah, they're not.
Can you ask your brother how he's doing today?
Yeah, he's fine.
Does he have any problems at all, or like why is he here today? It's like maybe he has a little gas or something.
Yeah, so some little gas.
Maybe a little gas. Okay. Did he have any past medical history, any medical problems at all?
No,
one day it's a young virgin at the postal Chinapa. Hotel Cheese on to yet a can go a bit on. They don't much also. The join us from Stamatona. What I'm mean about it, rotated like a chain.
No, so
you own a customer make
yeah, no.
No past medical history?
It's fine, no.
All right, good. Can you ask him if he's ever had TB, like a pneumonia for a long time, coughing, weight loss, night sweats, hemoptysis, lymphadenopathy, anorexia?
HIV, I can't go in the middle. No.
Has he ever lived with anyone that had TB?
We live together, no TB.
Oh, good. How about syphilis? Can you ask him if he knows about syphilis or if he's ever had it? Some of these people just go out there having sex with everyone. I think they just weren't raised right. They get all sorts of diseases. So just ask him about syphilis.
Yeah. He's fit. He only sleeps with his wife.
Okay, all right. He doesn't look that hot. Do you have any constipation, diarrhea, hematochezia, hematemesis, mid-epigastric pain, anorexia? Has he eaten something funny or not been washing his hands?
Oh,
What's he saying?
Yeah, he wants his hands, yeah.
All right. So basically, he's not that sick and he's got some gas?
Yeah, it's some gas.
Okay, good. Let me just check a couple last things. Oh, man, his blood pressure is really high. I'm going to go tell the nurses they should recheck it. It can't be that high. He probably just was nervous. Wait here, I'll be right back.
So what do you guys think? As a family member, a good thing to bring them? Probably not, right? All right, one more. It's an urgent care, so.
Call an interpreter.
Hi, how are you?
Gracias. Estoy bien, pero está mal mi hijo.
Doctor, do you want me to get an interpreter? No, I think I'm okay. I think my Spanish is fine. Okay. Bueno, señora, ¿cómo la pasó esto?
Se pegó cuando se cayó.
Oh, you know what, nurse? I think we should call the social worker and child protection. It sounded like she said that somebody hit the child and then he fell down. Okay, doctor.
I'm one of the doctors who's taking care of Abdi, and I just wanted to talk to you a little bit about some things we've been doing. And the good news is that we've done some lab tests and we've gotten some results. Oh, you don't understand. Oh, I'm sorry. Let me see if we can find somebody who can help us. Mohammed, Can you help us here?
Sure, doctor, I would be happy to.
This is Abdi's sister, and I wanted to tell her about Abdi's condition. He has some very bad infections, and we're trying to figure out what's caused these infections and made him so sick. We've done some lab tests for HIV and hepatitis, and those lab tests have come back negative.
dhakhtarku wuxuu yiri walaalkaa AIDS uu qabo waa arrin fiican sababtoo ah waa cudur inuu ku dhaco dadka khaniiska ah.
All right, give me your feedback. So we can say that there was a little bit of comedy here involved, but at the end of the day, those situations are serious. The brother could get maybe a heart attack or something, eventually collapse somewhere. The poor mother could lose her child, right? So there's a lot of different situations that are happening when the strangers are involved in the interpretation, and it happens often. It happens very often among family members, and like the second and third video, it happens in the hospitals and clinics where, well, doctors sometimes think they can handle it by their own, but no. It will change a lot. So we want to avoid that, and that's why you guys are here. That's why you are the heroes, to protect those poor people to not get those heart attacks eventually or any other problems. That is the whole idea of that. That's why the messages need to be delivered by the professionals and accurate. All right. Terminologies that can be difficult, all the clarification problems. So there is a lot of unfamiliar words that we all came across. Probably if we look back and if we go to the doctor in our own country, we don't even understand what they are talking to us about sometimes, right? If the doctor is going to start coming up with this Latina words for all medication and problems in my health, so we cannot understand those things. So, and that medicine terminology is like, it's not stopping. It's not stopping. It's evolving, and it's getting constantly different. There are changes. Some meds can change their names as well. So there's a lot of different changes in the healthcare services. So a good idea is here that if you are going to any of the medical sessions, you don't want to pretend that you know everything, because probably you don't. And you don't want to assure the patient that you know everything regarding the vocabulary, any medication, specific names and stuff. So you don't want to feel them that they're okay, that they can trust you in that, because eventually you're going to end up guessing, and guessing will lead to serious problems, right? So even if it's a small mistake, even if you think that you know, yeah, it can lead to huge issues, and the consequences can be dramatic at the end of the day. So I encourage, always ask for clarification. There is absolutely nothing wrong with that, because you guys are not doctors. You did not probably, like, you didn't study the whole Asian terminologies, and, you know, starting from the ancient Greece, whatever was developed, and those funny names and long names for medication. So I encourage, yes, ask for the clarification to the healthcare provider, so you can actually like explain the patient what is this medication, or what is the problem that they actually have, right? What is the, how do they name their sickness in this case? If you don't understand the term, yeah, it's a clarification. you can check it out. Now, by the rule, and this is something I'm always telling the new interpreters as well, try to avoid your cell phones and stuff. But if there is actually like a situation like this where you need that clarification, you might need it eventually. Another thing is that whenever it comes to actual like serious sessions, medical sessions, well, I'm helping you out as well. So I'm creating you a full glossary for that session. The words that might most likely be used and involved in that conversation, the meds that might be involved in that appointment. So I'm preparing those names for you. So at least you have a little cheat sheet with you that you're not going empty-handed. Of course, I cannot provide the full like information, diagnosis or stuff, but at least I can help a little bit in that case, right? So that's what's usually happening. But again, clarification will help to explain. You can rephrase the word, maybe like the sentence that will help. And also, if you do not understand it in the first time, you can ask the healthcare provider to repeat that. There's nothing wrong with that. Now, why there's nothing wrong with that, we'll go to that in probably next slide. But yeah, technically, you have those rights to ask the questions, right? Now the request to ask, like, for the speech. So I hear that also in the previous sessions that there were a few times when the interpreters just got lost because people were just constantly talking. Maybe I think it happened in the legal settings, but it will happen also in the medical settings. And as you notice in that one of the videos, whenever there is that constant talking from one side, you will get lost eventually. Your short time memory will just not gonna comprehend like what's going on in this case, right? So you have right to tell them like, hey, slow down. I mean, in a more professional way, of course. But yes, you can ask them for that. By the book, you should say interpreter requests for slowing down or providing less information. So that information can be provided more accurate to this, right? Also, you can ask the healthcare provider for they can spell the names or the term. They can spell it to you. You guys are using notes, notebooks, right? So you can write those things, and that can also be helpful for that. Another thing is this. So how interpretation like the describing works. Well, it doesn't. How to say that? All right. So instead of guessing, you might to describe the problem to the patient. It's sometimes I know it happens, for example, a lot when indigenous languages are involved, like here in IHS right now in Canada or like North America. All the indigenous languages do not have actual names for a lot of different things, and to provide that information to the patient, the translators, the speakers, they need to provide a description of the problem and description of what will happen. So they, instead of interpreting itself, they're kind of telling the story to the patient to understand what's going on during the with their health and what kind of medication they will have to take and stuff, right? But when you doing that, this like trying to describe and you cannot find the proper word, just be always like a little bit more careful how you want to describe it. So again, you are doing interpretation, you're not doing translation, and it's not gonna always be word to word. So description will help in interpretation. You just need to know how to approach that and how provide the description. All right, transparency, well, here pretty clear, never hide anything from both sides, especially from the patient. So if you are not familiar with something, again, you have to talk about that. You have to ask. If you don't want to hide anything regarding the diagnosis from the patient, if you do not know the word, do not skip that word. Again, so transparency is very important here. And yeah, well, again, guessing. So it can lead to a wrong diagnosis, treatments. It can harm the patient eventually if you're gonna start guessing, especially about the dosage of the meds or something. So it can, yeah, it can change a lot regarding. All right, what we have next? Let me see. Wait, I'm supposed to have a video again. What time is it? All right, well, we have to speed it up. All right, the last video today. And after that, we can go. Oh, no, never mind, actually. We're not gonna watch this. Never mind, sorry. We're gonna watch the other one. All right. So, almost 2 slides left. Managing the interactions. Now, managing why people are keep joining? It's almost over. All right. So, wait, where am I here? Am I in the right slide here, or did I get lost? Oh, no. All right. So how you manage the session and how you take the control. So that's something I was just talking in the previous slide. Well, you as an interpreter, guess what? You are the boss. In any settings the interpreter is involved, you can consider yourself as a supervisor of that meeting, right? So that means you can dictate conditions here. And the earlier you do that, the better the situation will be handled, and there will be better outcome from the meeting. So as a boss, you can stop both parties. You can tell them to slow down. You can tell them about those explanations, like we mentioned in the slide before. Now, in the you cannot stay absolutely passive in the room. Okay, you have to deliver still the message, and you need to set up those boundaries, and you need to manage this session. So again, if the doctor is going too fast for you, slow them down. If the clients is, instead of telling them what is the problem with their health and telling you the story that was happening 20 years ago, stop them up. You have to provide the information, the most accurate information, right? And sometimes you don't have time for this. Maybe you are only booked for 1 hour. Maybe you're only booked for 30 minutes. So it's very important that the situation need to be only related to the information that are important. So that's pretty much how it works in the session. So again, whenever the session starts, you always try to start the session telling in both languages who you are, why are you over there, and you will state that, please, I would like to have a short segments of your message so I can deliver the most accurate interpretation. And you can also, some of the interpreters have their own rules as well. So you can come up with something, and that will also be helpful. But yeah, in general, you are the person who will manage that session. Do we have time for questions? Just give me 2 minutes. Give me 2 minutes. All right, so those long speeches. Again, we're talking here about the memory, and it will impact your memory, and you don't want that. So you will pretty much say interpreter request a pause, interpreter request slower talking, or like you can figure out something that can stop. So interruption, if you interrupt, it's fine. If you take notes, it's fine. And eventually you will deliver a better message in those little segments of the meeting, right? So especially in the consecutive appointment interpretation, those sessions are different. So you have time for that. You have time to make the notes, and you can keep listening and then just pretty much do the interpretation, right? To get ready for the sessions, again, be sure you have always a notebook with you, notepad. And like, don't bring the laptops, but a piece of paper and a pencil will be fine. It will help you a lot. Again, at the end of the session, each of those need to be removed, need to be destroyed. So just be sure that. All right, the first person, which is the important, and we talked about this yesterday as well. Even if it's very obvious for you, it's not very obvious for them, especially requesters, doctors, or lawyers, you name them. They do not understand that sometimes. They do not understand the rules of the service you will provide. And it can be confusing for them, because now they will hear the information from you as the first person, not from the patient. And that can it can lead sometimes to some confusions here and there, right? Also, if we're talking about the patient, again, if the patient feel the pain and will say, I feel the pain, you will say, I feel the pain. So that must be handled in the first person all the time. All right, so we have, oh wow, I'm not gonna make it today. All right, a quick video about those things. Hopefully we can go through that. So speaking in first person, pretty short one. So let's.
Why is it important to speak in the first person when interpreting? Hello and welcome to my YouTube channel. My name is Alhan and I'm an interpreter, translator, and a children's author. Notice that when I evaluate some interpreters who want to enter the company that I'm in contract with, some of them do not know what it means to speak in the first person versus the third person. So let's clarify that point first. Speaking in the first person means I, we. Speaking in the third person means he, she, or they. Why is it important for an interpreter to speak in the first person versus the third person? A very common mistake new interpreters make, or interpreters who only have some experience without their education of interpreting, is that they speak in the third person. For instance, the patient comes to the doctor's room. He says, I have a headache. The interpreter says, she has a headache. Instead of that, the interpreter needs to repeat exactly what the patient is saying with the same pronouns, with the same tonality, exactly the same way. You are an echo to the speaker. That's it. Period. It's a very, very important lesson for us interpreters as human beings to be very selfless and forget about ourselves and just imagine that we are the speaker there repeating what they're saying in another language without changing the message, without changing the tonality, without changing the pronoun. So make sure when the patient says, I have a headache, you repeat as an interpreter, I have a headache. Now, you might ask me, okay, what if I would like the speaker to repeat what they said? What if I want to say something as an interpreter? For instance, I need a short break. Could you please repeat what you said? Something that the interpreter has to do in such incidents is clarify that it's the interpreter who's speaking. For instance, if you want the speaker to repeat, you would say, "This is the interpreter speaking. Would you please repeat what you said?" Throughout the interpreting assignment or the interpreting call, the interpreter should refer to themselves as the interpreter. For instance, the interpreter is asking for repetition. The interpreter would like to request a 5-minute break. The interpreter would like to take a minute to find this word because it's a new terminology. The interpreter cannot hear you well. You refer to yourself as the interpreter, not as I, because there needs to be a clear distinction that what you're saying is you as the interpreter, or what you're saying is the echo to the other person. I hope this has been helpful to you. If you have any questions, please write them in the comment section below.
All right. Questions?
That's a very helpful video. Exactly with examples. Thank you, Peter. Just one thing, can I please have a copy of today's webinar before I forget? Because I had to miss like almost 1 hour because of a call today.
Yes, everyone will get that.
Wonderful. And just a clarification about what you said earlier. You said that when you were talking about like when people have like long stories and we as interpreters have like maybe 1 hour session, that does happen. So could you clarify that part about as interpreters when they are like say when they're asked a simple question and then they start to tell like life stories in there, like what I didn't quite understand how is the best way to handle that scenario other than
Well, the best way to handle a scenario, you can say the interpreter is asking for a shorter answer.
Okay.
Right? Because, I mean, sure, yes, you want to be friendly and all of that, but no one has time to listen what happened to the uncle in 1953.
But then how do we explain, how do we make it how do we convey, or like the service provider then when we interrupt and we request interpreters requesting a shorter
Oh, well, you can interrupt them. You can interrupt both parties. You can interrupt both parties, and there's nothing wrong with that, right? The thing is that, well, just don't be rude. Just tell them politely that you request a shorter amount of words because you have to deliver that message right away. I think, well, the only difference, actually, there is only one exception here: psychological appointments. That's where the clients pretty much can talk a little bit more, but you have to be prepared for that as well. So I recommend to make notes for that. Okay. Yes, Abigail, go ahead, because I still have a couple things to talk.
Okay, yeah, so then all those videos were very informative for me as well. And especially like how do we proceed in terms of, if it's something that we need as an interpreters to clarify. So how do we approach it? So then I think it was something that was very useful for me. But then the other thing that I wanted to say, I think it was on and the page before that, it was just in terms of how do we manage, how do we take control of the meeting? Because I just had a few years ago, I had a situation where I had to do the interpretation. I didn't know the client, but then that client brought somebody that I knew, and then practically she just wanted to get in the conversation, she wanted to explain absolutely anything. And then she just interrupted me and did not let me talk. So she was just saying, okay, so then I have the complete story. So then can you let me talk to the doctor? Because in that way he will know the entire story of it. So I didn't know what to do. I didn't know how to react to it.
So this is the part where you set up the boundaries, right, in the room. Because yeah, if you will hear something like that, or like, hey, can you explain to me something later, or like translate everything, you need to set up the boundary. And the person that was there and was not the actual patient, well, she has no words, no rights. So you're there only for the patient, and you are speaking directly to the patient. And if the person doesn't like that, the person can file the complaint maybe about you, but no one's gonna accept that complaint because you
Yeah,
are.
because actually what I did is I called the office and I said, this is a situation that happened. I was not happy about it. So then I'm just hoping that this client next time when he comes, then will bring himself, not other people with him, because it made me uncomfortable. It made me insecure. One, because I knew that person and that one that was doing the interpretation. And then number two, I was just in the corner, just watching and seeing all these scenario, and I couldn't do anything.
Yeah. No, that's yeah, regarding the boundaries, that's where you go, and you don't want to let them to take the control, because eventually if they will start doing what they want, it will just create a chaos over there, right? And then they're gonna speak, the other guy's gonna speak, the doctor gonna speak at the same time, and eventually, yeah, you'll be just in the middle of this tornado, and you don't want that, right? So that's why like setting up the boundaries is like right best on the beginning of the session. Like tell the healthcare provider you're here to interpret only for the patient, not for the other person, and the other person should be ignored for sure. Okay. Okay, I see another questions, guys. Let me just finish because we're running out. And this is a little important because we're talking about all the emotional stuff. So yeah, I will try to go quickly with this. So how we are getting those emotional interpretation situations, basically. So let's just quickly take have a quick talk about this, and then we can take the questions. So the most uncomfortable situations, the topics that will trigger, right? Any sensitive topics. So assault, harassment, trauma, sexual assault, death, a lot happening, situations for AHS. So those can be the situations where it can trigger something in all of us, and it will trigger some emotions here, right? And we need to be aware of that. So that's why if those appointments are coming to us, those requests are coming to us, I'm pretty much your main person of contact for this, and I will get everything ready as best as possible to get you ready for this. Of course, before even assigning an interpreter, like any of you working with us, you will get a call most likely from me or someone else, but we will tell you what this is about. If this is something serious, we will tell you like ahead. Do you feel comfortable to attend in this meeting? So like from our end, you will never be forced to anything. We're never gonna tell you like, hey, just go. It's just a random session. But no, if I see something that is critical, can be triggering and sensitive, I will let you know about that. Another thing that medical interpreters might to be involved is those diagnoses where the whole family will be involved. So again, most of the time, from my experience, I noticed from IHS, for example, is the end of life sessions. So again, that's where the decision is coming when they're gonna shut down the machine for the patient, and the whole family is involved. And now you are standing there between the doctor and the family, and you have to tell them what's going to happen, and they have to agree to that. So there's a lot going on. So this is something probably that none of us is prepared. And honestly, I do not have best solution how to deal with that. I guess everyone can deal it on their own somehow. The best way how you find. But during the appointment, again, you still need to be professional, and that might be the hardest part, because they cannot see you that you're going to start crying before them. You will get angry with them or before them. A lot of those situations will be triggering. Like, let's be honest, it's a healthcare, right? So all can happen. So again, you have to stay as calm as possible, absolutely steady, professional, neutral face. And that's where, of course, if the emotions are involved, yes, you can deliver those emotions as well. There was a video I wanted to show you, but yeah, we have no time. The one interpreter was saying that she was involved in the birth of the child. So in the middle of delivery, right? So of course the family was involved, and that's when she said that yes, those emotions, yeah, like you have to let it go sometimes as well, because obviously you don't want to have like a poker face and tell them like, I'm happy for you, right? So we're talking about something that yes, you can deliver those messages where the emotions are involved. Also in the other videos you saw that when the anger is involved, delivery of those messages, including the emotions, that mix, also change the tone of the message from the patient. Now the doctors can also understand, like, okay, so yes, he's frustrated about this. There is a problem. There is a problem, like that, right? Another thing, well, if we go into the anger and stuff, how you can deal when we're dealing with the inappropriate language during those sessions, right? So now you are the interpreter, you're bound by the code, you have to go for the accuracy, and then in discussion pretty much, is getting bad, situation is escalating, everyone are mad. So you have to interpret still everything as it was said, right? So at the end, you will have to interpret whatever was said by the patient or by the doctor in the same way as it was. So again, if you change something, if you miss something, well, that's not going to be accurate anymore, right? So just keeping that in mind. Again, if most of the time, well, I'm actually every time, if there is that drama, that tension between the healthcare provider and the patient, keep in mind it's not personal. It's not against you. You are there only to deliver the message between them. If they want to argue or yell at each other and they're angry, well, let them do it. But eventually, like, you also gonna have to stop it at some point, because you don't have time to wait until they finish arguing after 2 hours, right? So I will say, if there's actual frustration from the patient, sure, you have to interpret everything. Let them go for a minute or two if they have to, but at some point, again, we're coming back to that plan when you're the supervisor of the appointment, right? You have to stop them. So that's something that to keep in mind, basically. Another thing, well, the last thing actually, how you deal with those difficult clients. There's a lot of them. People are people, and we all know that. And people can be difficult, annoying, and a lot can happen. So, again, well, at the end of the day, you don't want to keep the patient, the client happy, I guess. But you also need to set up those boundaries. If you feel like that client is actually will make the problems, it's going to be easier and faster to tell them right away how this appointment will be handled. And if they don't like it, of course, they can file the complaint. You will do your job, but you are not here to argue with them or to fight with them, to play with them. So that should be clarified right at the beginning, because we never know. We never know. People are different, and yeah. I would say the only thing that to skip, try to not show your anger. So again, you stay neutral as much as possible, and just tell them the interpreter is asking, please stop, or something like that, right? They need to understand that you're there only to do the translation. You're not there to babysit them, to do anything, to fight with them. Plus, you want to finish your session in peace. You want to go home after that. There's no time for playing rounds for this. All right, we have the last 20 minutes pretty much. I'm gonna keep the last slide for tomorrow. Maybe I can fill it up, so that's fine. I think we covered a lot today, and it was a very important module. So pretty much whatever was said today, I would say it's not only HS, it's everywhere. The only difference that is happening is the change of the person you're translating for. From a patient to a client to claimant to someone that need your help, right? But in generally speaking, those core principles apply to all interpretation sessions everywhere. All right, Alejandra, please go ahead. You were waiting there for a long time.
Oh, it's okay. Yeah, so I have a question. Like, I don't know, it's kind of a situation that it has happened to me a few times, that when the customers, like I'm translating for, they understand most of it, and they can even speak back, and then they just called us because there's like some terminology that they don't understand. And basically, like, we're there right in the middle of the whole translation, and the doctor is saying something, and the client is not really letting us translate because he's answering like in English, for example, right away. Like what I do is I always like just mention that I'm here if you need it. I'm your translator, but like he's just jumping in and answering in English already. So like in that case, do I just let him keep going, and then just in case he gets stuck, I help him? That's what I kind of been doing, but like,
like you can just smack them.
It's like I'm here
and say, hey, behave. It's actually a funny part where suddenly when it comes to an anger and problems, they all speak English. Right? And I hear that a few times for other interpreters as well. Like that 55 minutes of the session is going well, interpretation is going well, and the last 5 minutes only something bad came out, and that person absolutely like he knows every single swearing word in English to jump on that doctor. So I would say yes. let them vent for 30 seconds. Let them vent if they have to. But again, you have to keep in mind that you are in charge over there, and you need to tell that to the both parties, right? And you also have no time, and
Yeah.
it's not your concern, and you don't want to be affected by that because, yeah, tell them stop it or I'm gonna be traumatized.
Well, not necessarily if they're arguing. Like the guys, like most of them, or not most of them, but some of them do speak English. Like they speak English and they understand English, and they just call us because like they might not understand fully.
Yeah.
But like it's kind of weird because we're like there, but they don't really need us, and we're like there just to translate one word or two. So that's
Well,
kind of...
I mean, if it's still required, so many times, depends from the situations. Like for example, WCB, or WorkSafe BC, or any other of those institutions, the client has no choice. If the case manager decide that they cannot communicate good in English, they will assign the interpreter. And the client has nothing to say about it, right? It's kind of like according to them. Now, if the client is private and they still kind of speak English, but they still want you at some point, yes. So I would say, yeah, you're just there on standby. I mean, time is ticking, the money is in your pocket, right? At the end of the day.
Yeah. And like sometimes the customers, they don't really understand everything. They think they do, but they don't, because the doctor asks them something and they answer, but it's like it makes no sense what they answered. So like they think they do, but they really don't.
Well, you can keep, like, if you notice that they do speak some English, tell them on the beginning, like, I'm here, just tell me when, and I will start doing interpretation for you. If you think you can handle the basic conversation, that's fine. But yeah, for any difficult terminology, that's why you are over there, right?
Okay, yeah,
So
okay.
there is nothing like you're doing wrong. You're not.
Okay, thank you.
Sure. Laura.
Yeah, hi Peter.
Hi.
You says there's an exam after which will cover module 1 to 5, no?
Is it what?
There's an exam after the fifth module. It says there's an exam. So if I'm not wrong, this is the 4th one, isn't it?
No.
This is not the 4th module.
No, today's module 2.
Well, it was the legal, and then was the medical, and then is today.
So we had Monday was module 1 legal, Tuesday was module 1 medical, yesterday was module 2 legal, today is module 2 medical, tomorrow will be module 3 legal.
Oh, this is how you count them. Okay, so 5 of the legal, 5 of the medical. Okay, I thought the 5th one or the 4th one.
No.
Okay.
So I mean, well, we can go for the total if you guys want. We can do after 5 modules and just combine medical and legal exam and do it if you want. But
and
I prefer to skip that because not. So the reason why I'm doing two different exams is that not everyone here want to do legal stuff, and not everyone here want to do medical stuff.
Oh, right? Okay, I gotcha.
So that's how it's gonna work. But yeah, you're saying
when will be the end of the 5th one? You will leave us a little bit of time to kind of review those videos on YouTube, because you know we have something else to do too. So it's
yes. No. We're gonna go pretty much like actual, school stuff. So we're gonna do the review. I will send those. I promise I will send before weekend those videos. I will. Even if I have to buy the hard drives, I will send them. Okay. It will be done.
All right then.
So before that, yes, probably the slide for where's the schedule? Does anyone have a schedule I sent? All right. All right, so let's quickly take a look at this here. What's going on exactly so we can be on the same page, right? So this is the schedule that was sent to everyone on the beginning. And we are currently where? March 27, right? 26, 27. Medical, we're here. So your module 5 is coming up on April 7th. And after that, we will do the exam. For medical.
So after that, what means in eighth, where we will have a little bit of time to review all the videos and to repeat.
Let's see. So module 5 will be on the 7th. Wait, why do I have April 7 and April 6? It's April 9, the next day. Yeah, so let's, well, I can ask people, we can send an email to everyone and we can find a date that's gonna work for everyone. Probably not one date gonna work for everyone, so I will probably do, yeah, I guess we're gonna do the slide 5 on the April 7 and then April 8, 9, and 10. That's where we're gonna do the exams for 3 days.
Okay, yeah.
Right. So the April 7, so April 7 we have module 5 and review. So we're gonna separate that, let's say 1 hour of the modules and 1 hour for the review, and that's gonna be for the medical. And for legal, we have here what? Module 5 is on April 1, but now we have so it's Wednesday. 2nd. So we're gonna probably skip this one. Module 6, we're gonna skip on April 6th, and that's where the exams can start for the medical.
Okay.
So I have to figure this one out to make everyone happy, because I have no idea how many people will want to do the exam. I mean, looking at the attendance right now, who knows, maybe everyone. That's already like 200 people. So that's a lot. But yes, I'll be in touch probably next week. I will make some deadlines here and there, and then we can, during the sessions probably next week as well, we can find some kind of solutions for everyone to make you all happy for this.
Okay.
All right. All right. Okay. Daisy, please go ahead.
Are we allowed to file a complaint against the doctor? Or we have to go through you guys?
Oh my God, what did you do?
I didn't do anything. What did they do?
Okay. Yes, you are. Yes, you are. And you are absolutely encouraged, because I have no feedbacks or complaints from the interpreters regarding the sessions.
Because I have a long paragraph.
Oh my, that sounds scary. Yes, but I need to have it in the email. So it's actually a formal letter of the incident, of the situation, and your formal complaint.
Okay.
But yes, I encourage everyone, guys, because if people complain about you, well, I'm pretty sure there is another side of the story, always, right? And very often the other side, which is your side, is actually more better. We can
Homer, could you please mute yourself? Because we can't hear the answer.
Thank you.
Mute your guys.
We mute him. So yeah, go ahead. Send me all your feedbacks. If you have days and times and claim numbers and something, go ahead. We can figure it out. Laura, you have something more?
No, I'm good, Peter. Thank you.
All right. Any other questions? Any feedback? Anything? Yes, no? Or we're good for today? Okay.
I have a question quickly, sorry.
Yes.
I just wanted to check, I won't be able to be here in the meeting for tomorrow. So is it a way that I can request or I can ask for somebody to give me notes for what is gonna happen tomorrow? Or is gonna be on YouTube, or how am I
Well,
gonna be able to?
eventually, so the plan is, yes, eventually, all the recordings videos will be on YouTube. And for each of those modules we're doing, I am preparing a full written session of that.
Okay.
With those videos, with the links for YouTube's videos we're watching, with pretty much everything. So I kind of like, yeah, I'm preparing you a book to study as well.
Okay, and we're gonna be able to have the link of the YouTube because sorry, maybe I'm lost on that side, but I don't have access for a YouTube.
Oh, like the channel, the YouTube channel?
Yes.
Oh yeah,
Yes.
of course. Well, how you want to watch the videos if I not give you the link for the channel?
Yeah, so I don't have the link. That's why, just because I've
Yes.
been working
No,
from
it's
home, right? So then
yeah.
maybe that's why I don't have access to that, or I don't have that.
No, it's all gonna be provided for all of you. It will be spread to among all 800 people I'm currently working with.
Okay, thank you.
So no one gonna be missed for that. Kafsar, go ahead, please.
Yeah, hi Peter. I just have a quick question. For example, like if the clients are private, like they falls in which category? Is it like the business meetings and all like that? The private clients. The private clients.
Well, the
Who are
private
they?
clients can be in all different environments. So it depends. Like, so let's say we have a client that requires an interpreter at their hospital. Well, it's gonna be under medical. If the client has a problem with the law and now is in the law office or at the court, it's gonna be legal. And we also can have private clients who are doing their own WCB claims. So let's say a business owner, self-employed person. In that case, yeah, they're also private clients. So there's a lot going on, and then we'll see how it goes. But yeah, it all depends.
But once we are assigned for interpretation, we will like you will let us know like it's a private or like in which sector.
No, actually, I will not, because I do not know until there's actual problem. Like I'm by myself, I'm not involved in the booking process. So and we usually calling them private, it's kind of more like an internal part. If we have to assign you, you will know it's illegal or medical, pretty much, right? So, and I think that counts a little bit more because in that case, at least you know, okay, I will get paid for medical or I will get paid for legal. If I will tell you, hey, you will get paid for the private, well, that doesn't tell you anything anyway.
Yeah, exactly.
Right.
Yeah.
So yeah, so the private clients are, yeah, it's more like for internal. Yeah.
Yeah, got it. Thank you.
Sure. Bing Wen, please go ahead.
Yeah, I also want to know if I can have some books to read or.
Yeah.
So, what books do you recommend or?
Right now?
For our program, I mean.
Well, I don't have an actual book. I'm going from my head and my research, but I am writing a book for you.
Okay. Okay.
Right?
Okay.
Perfect. I mean, no, there are some books. And I'm actually checking out different website with the vocabulary and stuff. So that will be something you guys as well. Because there's a lot of different websites where you can just quickly put the word and it will find you like all the synonyms of the word as well.
Okay.
So yeah, materials are coming, everything's coming, videos are coming. Yes.
Okay, perfect.
Sure.
Waiting for it.
Gail, you have something?
Yes, I just wanted to ask in regards of this other lady that was talking about private clients that might happen. So I'm sure that if we're not aware that we're going to translate or do an interpretation for a private, then they will have the policy in terms of what is what we supposed to be doing, what is what we're not, because there is cases where the clients are asking, can you please help me to fill up the forms? When maybe that part is not my part. So then, is there a policy that they will have that what is what I will have to do in my duties and what is what I don't?
I'm just double checking if there is actually says anywhere if it's a private. No, it's not. No, it's only for the internal system. So regarding reading anything, translating the files, you are not a translator. That's
I'm
number
sorry, interpreter. I mean interpreter. If so, then if the client asks, can you please help me to write this information?
So yeah, so again, but it's kind of connected to the translation. So you are not a translator, you are an interpreter, and all you can do at this moment, you can provide the site translation. Right? So your site translation is you can tell them what is in the file. You can translate what is in the file, but you cannot hold the pen and fill up the form for them.
Okay. Okay.
They are responsible to fill up the form, right? So you can tell them, okay, you have to put that you broke your leg right in this box, right? And they have to, you can tell them how to say like broke his leg or something, but again, you are not providing those information for them. If they ask you, absolutely not. You're not responsible for filling up the forms for anyone.
Okay, I just wanted to make sure that I will know and that person will know my boundaries and then their rights and
You
wrongs.
are providing only verbal interpretation, and in the site translation, it's still a verbal interpretation translation kind of slash, but you're not actually like writing those forms for them, right? So that's pretty much how it works. Also regarding if they are providing you like a fancy, like, you know, complex medical report, I will not do that. Do not do the translation for them, because then they will ask you, okay, so can you write it down for me what you translated? You will do that, and eventually, you know, 6 months later, they said like, oh, you know what? I lost my ear because she translated that my right knee wasn't broken. It's not related, has nothing to do, right? But they gonna do it like, oh, that was the evil interpreter. Yeah. So, and that's eventually gonna end up in the legal matter. So yes, all of you guys want to avoid any translation. All right, let's wrap it up for today.
Peter, as Omar here, just quick question.
Sure.
In like if the client has like survey or assessment, there is forms, consent form, there is another kind of forms. So if the client have an English problem, he cannot write or read, can we fill out the forms and they can sign for it?
Have you been muted in the last 2 minutes?
No, I'm not.
No,
I'm not.
no,
Can you
no.
hear me?
So no, we are not doing anything. You're not filling up anything. Tell them you don't know how to write.
I'm sorry to interrupt here, Peter. You made me laugh. I'll say something like in the like today's and day before yesterday's assignment. Actually, the receptionist herself, she gave me the form to fill for the patient. So what do I say her in this case? Like she's the staff there, but she's asking me.
So you can tell them, okay, thank you. I will give it to the patient.
But patient should think like, I don't know how to read and write.
Oh my dear. Well, then ask the reception maybe to. I mean.
Yeah, that's what usually happens.
Yeah, you want to, okay, so you want to help them. I know you guys want to help them, but if something will be wrong even if it's not wrong, and you put up everything correct, and people just will decide, oh, I might get benefits from that, but now I have to blame the interpreter who did the translation for me 6 months ago. Yeah, you're gonna end up in that law.
Sorry, Peter, this was Omar. We got some interrupted though. But I seen a lot of interpreters filling out the forms by themselves beside the client. So we should have a concrete rules for all of us. What do we have to do? We don't. So we have to have something do and don't. Because, for example, there is a client with me before, and then they come back after a while, they got injured again, or they come back for the session. So we have different interests as interpreters. Oh, before I was in this clinic, and then the interpreter helped me this and this and this and that. When you say, no, that's not part of my job, they feel like you refuse them. So we have to have, as a company, we should have some guidelines, what we have to do, what we don't, because we have to be in the same page. Do you know what I mean?
All right. So here, so that's the idea of this program.
Yes.
We provide. Okay. So I just quickly Google this just to be sure that you guys will not say that, oh, Peter is not correct. Short answer, no. Interpreters should not fill out forms for patients or clients. The reason why, it's considered as advocacy. Now, you are not neutral anymore. There is a risk that writing the client form, there's a risk of altering meaning, accuracy problem. Liability, the information become legally attending. Scope of practice, interpreters facilitate communication, they do not act on behalf of any client or patient.
Yeah.
And there you go, Omar, just for you, the do and don'ts.
Right, thank you.
That.
So yeah, as
no, hold on, I can
interpreters,
read you that.
Yeah.
So, not do. What interpreter should not do? Fill out intake forms, write answers on behalf of the client, explain or interpret questions independently, which is like the reports, medical report stuff. Make decisions about how to phrase responses in those documents. What the interpreter can do, interpret the form question by question. So you're doing the side translation, right? Interpret the client's answer exactly. So again, that's where the interpretation is coming. You can ask for the repetition during the interpretation, but eventually you are not doing anything written forms. Okay? We're gonna write a book for this. What do you think about that, Mingwen? Can we write a book about this too? We're gonna do it. No, that's a good idea. We're gonna do the do and don'ts. Good job.
Peter,
yes.
I have a question. Yes. So we, as a WCB client, we have a form to fill up when they start the session, right? The consent form, the pain levels, where they have pain, those kind of, everybody can be relate to that question. So we are only reading and interpreting what it says, or we have to help them to fill up the form. So in this case, how do we do? Are we allowed to fill up those forms?
Hey, Azeb, have you been here 15 seconds ago?
She was sleeping a little bit.
No, I was here.
What the interpreter should not do: fill out intake forms, write answers on behalf of the client. I will, you know what? I will send you like in the big like letters in the email.
Thank you, Peter.
Yes.
I will love
Interpreters, no, you guys are not responsible for filling up any forms for the clients or the patients. It's not your responsibility. You are only providing interpretation. Again, side translation is different. You can tell them that this is where they have to put the answer, right? If they don't know how to write or read, I don't know, tell them to put the cross. but please do not hold that pen and do not write anything for them, because what does it say in the point 3? Legal responsibility, liability. The information becomes legally attributable. And now they can legally sue you for providing false information, because they said that medical report never existed. I don't know where you guys find those information that you provided in the form, right? So I know, be friendly, be polite, be professional, but never ever trust people, especially if it comes to any legal matter. Okay. For that, they have translators. We work with the translators who are certified translators. They have their stamps, they have their seals, and they will sign their name under that yes, I did the translation for this client, and I'm legally responsible for it. Oh my gosh, Diana, your keyboard. Hey, Sakshi, last one.
Yeah, so regarding the similar thing which is ongoing, writing down something for the claimant, I was in a psychologist session, and the claimant had a broken hand, and he was there for that reason, right hand. And the psychologist was writing, they asked me to write down some recommendations in order to have a better sleep and the better routine. So she asked me to write down those recommendations with no signature and stuff. So I wrote it down. Hope that is okay. No, that is also not okay.
What did you
okay. I was there. I'm sorry. I got your answer. No.
Did you provide your own recommendations?
So no. It was all discussed by them and then written in front of them.
Okay. But what if, so here's my question. What if they told you, so write down recommendations for the person to have a better sleep, and one of the recommendation is to speed up and hit the wall with your head?
Okay, I got it.
Are you gonna write? So are you gonna write this one down?
No.
Well, because now it's a recommendation with a signature, and the client will say, "Oh, so if to sleep better, I just have to run into
okay, got your point. Okay, sorry, bye-bye.
No, of course, I'm joking, but you see the context, right? Like you see the situations where even if the healthcare provider want to do something good, they sometimes might to put you in some dangerous situations here, right? Because if something will happen, let's say, well, now all the jokes ahead. Let's say they gave one of the recommendation to take, I don't know, 6 or 7 pills to have a better sleep. And it's only after those 7 pills that poor guy had a heart attack, right? So now what they're going to do? They're going to go to the hospital and they say, why did you recommend that? And that the doctor going to say, I didn't recommend anything. I don't know what your interpreter write down, but I didn't say anything about 6 pills. I said 6 weeks.
And I think that if the doctors are recommending, then if they are recommending, they should write it, because they are the ones that are recommending, not us.
And you want their signatures.
To do that. Yeah.
And you want their signatures. Because the last thing you want to have end up in a jail for the 6 pills of melatonin and with a guy with a heart attack. Because believe me, they will not going to protect you at the end, right? So, putting all the jokes aside, guys, be careful with filling up the forms or writing anything, because paper is paper and it will survive when it's needed.
Sorry, I just want to be very clear, and regarding forgive me, but what about in terms of exact answer about tablets? They hand
the interpreters these tablets with the questionnaires, and sometimes like if it's a hand injury, so the person has like a hand injury maybe, and you are supposed to sight translate those questions, and so what I'm understanding, to make sure that I understand clearly, is that in those situations, the patient I do not hold that tablet and translate it from I would like lean over the patient